Hi everyone, my name is Lisa Tichy. I'm a first-year master's student in the Kinesiology department and a part of Dr. Tracy Perry's Exercise Oncology and Cardioprotection lab. Today I will be presenting you one of our recent research studies with the title Protective Effects of Preconditioning Exercise on Skeletal Muscle Strength and Tumor Growth in the Female Tumor-Bearing Mouse. First of all, why are we interested in this study, and how is it important to the community? Many of you probably know someone or know of someone who is suffering from some type of cancer, which is a terrible disease anyway. But often, with cancer comes cancer cachexia. So, what is cancer cachexia? It is a complex metabolic wasting disease that affects up to 80% of cancer patients and results in death in up to 1/3 of cancer patients. One of the symptoms of cancer cachexia is muscle wasting. Even though the research in this field is growing, there is still no clear diagnostic criteria or treatments for this condition. Some research has shown that exercise interventions have a positive impact on inhibiting tumor growth and preserving muscle mass. Most exercise treatments are easily accessible and affordable for cancer patients. Therefore, the importance of exercise as a protective and preventative measure needs to be examined further. There are still many questions remaining regarding the most effective timing and extent of exercise for it to have a protective effect. That is why we are interested in this field of research, and therefore we conducted this study to examine the effects of preconditioning exercise as a protective measure for cancer cachexia in female mice. To test this, we gathered a random sample of female mice and separated them into 4 groups: a sedentary and non-tumor-bearing group, a sedentary and tumor-bearing group, a treadmill-trained non-tumor-bearing group, and a treadmill-trained tumor-bearing group. The exercised mice underwent an 8-week treadmill exercise protocol, whereas the other groups remained sedentary during this time. After the 8 weeks were over, the tumor-bearing groups were implanted with tumor cells into one of their back legs. Then, all 4 groups were sedentary for 4 weeks. At the beginning of the study, after 8 weeks, and after the 12-week period, we measured grip strength as a measure of muscle strength and tumor growth to examine the development of cancer cachexia and the protective effect of preconditioning exercise. At the end of the study, we collected muscle tissue as well as tumor tissue from the mice. We will analyze the tissue in the near future to determine specific protein concentrations that are indicators for inflammation and muscle wasting. From the measurements and analyses of grip strength that we have done so far, we could see that the exercise-trained mice overall had an increase in grip strength compared to the sedentary mice, which can be seen in Figure 1. In Figure 2, a significant decrease in grip strength was noticeable when we compared the sedentary tumor-bearing mice to the sedentary non-tumor-bearing mice. Also, the muscle mass of the gastrocnemius, or calf muscle, of the sedentary tumor-bearing mice was significantly smaller than of the treadmill-trained tumor-bearing mice, which can be seen in Figure 3. When we looked at the tumor evaluations of the estimated tumor volume throughout the exercise protocol and the wet tumor mass from the tissue collected after the exercise protocol, the data showed that treadmill training resulted in a 60% decrease in tumor mass when comparing treadmill-trained mice to tumors of sedentary mice. Therefore, the analyzed data indicate that preconditioning exercise appears to play an important role in protecting muscle mass and inhibiting tumor growth during cancer cachexia. This information is crucial in understanding the significance of exercise and the timing of exercise interventions in cancer patients. I hope this presentation caught your interest and you learned a little bit about our field of research. If you have any questions, please feel free to reach out to me. Thank you so much for watching this video.